Hispanics are the largest and fastest growing ethnic minority in the state, nearly doubling in the decade ending in 2010. It's a group that also faces tremendous barriers to affordable health care. Organizations serving the Latino community are trying to remove those barriers, but say without additional resources, the Hispanic population will continue to fall through the cracks of Oklahoma's healthcare system.
Oklahoma is home to more than 330,000 Latinos, accounting for about 9% of the state's 3.8 million residents. Like much of the state's population, the Hispanic community faces significant health care issues, including cardiovascular disease, diabetes, and complications stemming from obesity and smoking. Dr. Charles Bryant is on the board of directors for the Latino Community Development Agency.
They suffer from the same risks that all of us in America do, that is, significant access to fast foods, processed foods, empty carbohydrates in terms of sodas and that sort of thing.
For many immigrants, coming to the United States actually increased their health risk.
In our countries, we have different lifestyles, you know. Here, different. Everything is faster, the first things. Everything is in your car. You live in your car, you move in your car. Normally in our countries, we walk long distance there.
Carmen Romo runs the Hispanic Initiative at Integra Southwest Medical Center in Oklahoma City. The initiative offers information about things like exercise and proper nutrition. They also host an annual Hispanic Health Fair in Oklahoma City
to give the Hispanic community information about the no-profit institutions around the city that can help them, not specific for the Hispanic, it's for everybody. But we put in this fair the Hispanic because the Hispanic need to know in her own language different programs that they have for help.
Language barriers often prevent Hispanics from seeking out health care in Oklahoma. Cultural differences are also an obstacle.
And I think many Hispanics are intimidated when they see someone who's not culturally similar to them, and they tend to be very hesitant sometimes to talk about things that to them are very private, but may have significant impact on their health.
Another factor is the furor over illegal immigration. After lawmakers passed House Bill 1804 6 years ago, fear of being deported kept many Latinos from seeking health care.
The atmosphere that was created several years ago had a tremendously chilling effect on these people, this population's reaching out and becoming involved in the community. They began to withdraw into communities where they did feel safe.
But the largest barrier to health care access within the Latino community is a lack of insurance. According to the Oklahoma State Department of Health, more than 40% of Hispanics don't have any kind of health insurance, far outstripping other racial and ethnic groups. Many can't get insurance because of the kind of jobs they hold.
They work for small employers, they're self-employed, they have their own little lawn company or something like that. They cannot afford insurance, but they either don't have the documentation necessary or they don't meet the financial criteria to fall into the Medicaid sooner care population.
Medicaid won't help since federal law requires Medicaid applicants to provide proof of citizenship to receive services. Even legal residents are barred from Medicaid coverage for the first 5 years after becoming citizens. Hispanic service organizations are trying to fill the gap in health care. The Latino Community Development Agency offers a host of programs ranging from immunizations to information about substance abuse.
We started with one program. Now we have more than 23 programs, especially in treatment programs, services in Spanish and in English,
Nora Chandler is the HIV program coordinator with the LCDA. With the number of HIV cases in the Hispanic community doubling in the past decade, the agency has stepped up its screening efforts.
A ver, me das tu dedo, aquí de este lado. Solamente vamos a hacer la pura mueca, así.
We provided free HIV testing, syphilis testing for men having sex with males, and we do referral You know, see if the person is HIV positive, we can refer that person to medical care.
The agency also offers a breast and cervical cancer screening program for women with no insurance and little income. Celia Hollis is the program coordinator.
We work in partnership with different providers to provide clinical breast exam, mammogram, pap smear, and everything is free, absolutely free.
Dr. Bryant says breast cancer screenings offered by the agency have helped identify women with early stages of the disease.
Those people would have not been identified, but would have ultimately showed up in an emergency room somewhere with an advanced stage of the disease and would have needed very expensive terminal kinds of cancer intervention had they not been picked up early.
Bryant says more safety net providers for the Hispanic community are needed, but lack of funding is a problem. Several hospitals in the state's larger metropolitan areas do offer free clinics, serving anyone regardless of nationality or immigration status.
Unfortunately, because they're volunteer and don't really have significant amounts of funding, many of these are not open on a regular basis. So they may be open one night a week, 2 nights a week. And if you happen to be able to go and you happen to get there before they're either full or before the medicine runs out or that sort of thing, then you're able to get some access to care.
Obviously, we need more support and more programs because, you know, Latino community is growing a lot in here in Oklahoma, so they need more help.